If you all happen to have read the paper today, you saw in the first page of the second session some concerns about where the pandemic is going and what the Department of Health and the state government of Hawaii can do. The quote from the Senator Brian Schatz is not the best quote, right? I am alarmed that there does not seem to be a plan yet for how to fully fund the contact tracing program after December 30th. The good news is that we're not always at the beckoning of the government, that other entities and nonprofits can be in play and can make a difference where the government may be a little slower for various reasons and cannot be as much as in play. We saw this particularly during the most recent election, in which there was a grassroots effort to get out the vote via mail-in ballots, and the churches were involved in this, not only the churches of the United Church of Christ, but the Catholics, the Episcopalians, Presbyterians, Lutherans, and all other communions as well. And we saw the result of that, right? The largest turnout of votes in Hawaii ever for a general election. So we do believe that grassroots power is an amazing thing in times like this. So thankfully, through Steve Jerby, who serves on Lanai, we made a connection with Robert Kurisu, who is part of a nonprofit that has developed an app to help with some of this tracing. And so he's here to guide us through that app to help us understand what it is. It is my hope and prayer that if this excites you and you're comfortable with this, you will turn around and introduce this to your congregation. There is a flyer that has been sent to us that will appear both, I believe, in the Coconut Wireless later today and up on our website, as well as what Robert presents here. So with no further ado, Robert, I turn it over to you.
Thank you, David, and good morning, everybody. Thank you for having me. So actually, I've been filling in for my cousin Brandon, who's expecting his first son this week. So I'm actually the second at bat, but he's actually the one who's been spearheading this effort on behalf of a coalition called the AlohaSafe Coalition, which is a nonprofit group that is comprised of volunteers here in Hawaii, that's partnered with the Hawaii Department of Health, as well as business, trade, and nonprofit organizations throughout the state, as well as the best and brightest out of MIT, Google, and Apple. So we're not doing this alone, and we obviously don't have that type of expertise here locally or the resources. So basically what we've done is we've assembled a team starting in March to help stand up the Department of Health's digital contact tracing program, which didn't exist, and they didn't have the resources or expertise to do it. So it's pretty unreal. And at the end of the day, I mean, at least for me personally, this is one of the most meaningful and I guess cool international collaborative efforts I've ever been a part of. And Hawaii has the opportunity to lead the country by having, one of the highest adoption rates out of any other state, by building engagement through conversations like these and through word of mouth, by establishing a really strong grassroots community level campaign. So just like this. So anyhow, please bear with me. I'm a real estate guy. I'm not a tech guy. So my explanations will be pretty high level, but please feel free to stop me anytime with any questions or calls for clarification. Okay, so what is AlohaSafe Alert? AlohaSafe Alert is a free smartphone app for iPhone and Android users, which is basically everything that's not Apple. It notifies users if they may have been exposed to COVID-19. The more people that use the app, the higher the efficacy, which will allow us as individuals to help take control in slowing the spread of the virus. So one more smartphone, the data is starting to show that every 2 smartphones can help save one infection. So how does it work? So say all of us here on this Zoom call today, we're meeting in person instead, but we all have the AlohaSafe Alert app installed on our smartphones. We're all sitting in a room talking story. But while we're doing that, our apps in the background are pinging each other. Pinging meaning they're sending Bluetooth signals, radio signals to each other, which in turn are measuring distance, so how far apart we are, and whether or not there's any obstructions in between, the duration of our interaction, as well as the date and time. So over the next day or week, I'm not feeling well, and I get tested and turns out I'm positive for COVID-19. Everyone at that meeting would automatically receive a notification from the app on their smartphone saying that they may have been exposed to COVID-19. Then to call your physician, get tested, quarantine. But the notification does not say who, it does not say where. And Uncle Kimo down the hall working in his office, or the landscape maintenance guy outside won't be notified because they will not have met that exposure criteria and will not have been deemed high risk. So basically, the technology takes all these measures into account, not to false notify or over notify people and create unwarranted or exasperated panic. So rather than our group being out and about socializing without knowing that one of us could have been exposed, we can keep our loved ones and friends safe, as well as others in the community that we don't even know. So the app is essentially about notifying people who may have been exposed to someone who's infectious but didn't know. It also allows the Department of Health to contact folks we don't know or they don't know. So we can imagine situations where not everyone knows each other, like riding the bus, waiting in a long line at the bank or supermarket, or even something like a church service. So fundamentally, AlohaSafe Alert has been built with privacy as an emphasis. And that's something that we're trying to do by having these individual conversations with people, that this technology at its core, built by Google and Apple and is being used worldwide, is built with privacy in mind. So our devices, what happens is they're talking to each other and they're sending gibberish basically with no identifiable information, no personal information. It does not track your location. It has no idea who or where you are. And utilizing this technology, the Department of Health and its epidemiologists have said that this exposure notification technology really enhances and complements traditional contact tracing methods. So it's not like this is standing up an entire new project or vertical requiring tons of resources by the Department of Health. More than anything, it helps amplify and leverage the existing resources. So it can speed up the whole contact notification process, reducing the time it takes for a person to find out they've been exposed, which enables people to quarantine and take the appropriate measures more quickly. And a lot of times during the contact tracing process, on the phone call with a case investigator, patients can't remember who they've been in contact with. Every single person for the past 2 weeks. I don't think any of us would be able to say specifically, right? Name every single person you've been exposed to or exposed over the past 2 weeks. We can't physically do that. And just as importantly, it catches unknown contacts, right? So like I was talking about earlier, people that we don't know, that we could never name or be able to provide contact information. So right now, I don't know if this is a good time to stop and ask if there are any questions. Some of the slides going forward get a little bit more technical about how the technology and the process works. I can gloss over some of those, but if you guys want me to continue, I will continue.
Are there any questions for Robert at this time?
I have a question. Say if somebody who has COVID already and he has this app, on his phone, and he's out there, like he doesn't have it, will it alert the people that has the app, hey, you know what? There's actually somebody there in the area that has COVID?
Yeah, so the way it works is, so if there's someone that already has COVID-19 right now and then downloads the app, is that the question?
My question is, yeah, someone who already has COVID and already has the app, but
Yeah.
instead of quarantining themselves, they go out there. And
Yeah.
so if they're near somebody who has the app, will they be alerted at that moment or no?
Yeah, so basically that's how it works. So in the process flow, in a slide that I'll show shortly, will show at which point in time during that case investigation, a person, basically the point is when someone tests positive, the Department of Health has the list of all the people who have tested positive. At that point in time, that's when the quote unquote the push notification will get pushed out to anybody who has the app, and then in turn have been in close contact with that person who tests positive. So I'll continue. So GAN is an acronym that Google and Apple exposure notifications is this technology that is already embedded in every single person's smartphone right now. If you guys are curious, you can go and look in your settings, and if you scroll down, I have an iPhone in particular, but under the general settings, if you scroll a bit farther down, there's an exposure notification section that basically you can toggle it on once you have your state or county or health authority jurisdiction. So in California, for example, in your particular county, if they've stood up the same notification program, you can turn that on.
Okay,
So this app, like I explained a little bit earlier, is the state of Hawaii's official notification app for COVID-19. The way Google and Apple have done it throughout the United States and the world is they're handing out basically they call it the keys, but it's basically, yeah, I guess that's a good analogy. The keys to the car. They're only giving it to the state or county's health authority. And so the Hawaii State Department of Health is the one that holds the keys to this car. And kind of along the lines of privacy and constitutional rights, it's a completely voluntary application. It's free. It's not mandated in a way, shape, or form as of yet. The Department of Health launched the app on Lanai when the first breakout happened, and I'm not sure if any of you guys were aware of that. But as of today, I think we have about close to 6,000 downloads, and obviously that's more than people that reside on Lanai. But after meetings with Maui County and whatnot, the next county to roll out this program will be Maui County, and they're trying to establish it with the quarantine process and having it part of, in order to become exempt from the mandatory quarantines, will require travelers to utilize this app. So we've kind of gone through this process, but essentially, if you test positive, what would happen is you had a call from your Department of Health case investigator, and you'd let them know that you have the AlohaSafe Alert application. And what that investigator would then do is provide you with a verification code, similar to when you're changing your password with your bank or any other secure service to verify. I guess it's an anonymized code that basically then provides the Department of Health with all the exposure keys that have been saved in your application over the past 2 weeks. So, all those people that you've interacted with and all that gibberish that your phones are talking to each other, is basically saving all these series of numbers and letters that basically mean nothing to anyone except for the purpose of this application. And so here's that process flow in case any of you were curious. But the patient gets tested and is confirmed positive. Investigator has a list of positive cases and calls them up. Patient tells the Department of Health they have the app. Investigator gives the person a verification code. You type the code into your app. The app or then uploads all that gibberish to this national key server that's hosted by Microsoft and the Association of Public Health Laboratories. And why this is meaningful is that the health authorities across the US are all sharing this same server. So basically those people who are traveling, say from Washington, Colorado, California, other states that are standing up the same program, they won't need to download another app. They will already have the same technology utilized in their own jurisdiction. So people will already have the same codes and technology being utilized already on their smartphone. So as of right now, these are the states that have already rolled out the same technology in their respective counties and states. So most importantly, at least for Hawaii, right, we're keeping an eye on the West Coast where we have a big volume of travelers and people returning home. So will AlohaSafe Alert be effective? So as I explained earlier, for every 2 app users, 1 infection can be avoided. Combined with other measures, if only 15% of our community uses the app, we can reduce infections and deaths by 6%. Hypothetically, if 80% of smartphone users downloaded the app, and that alone, we would be able enough to suppress the pandemic without any other form of intervention. So that's just a hypothetical example. Granted, we have other measures in place. We have vaccines that are being rolled out, but ultimately, as another method of trying to suppress and control the pandemic, utilizing technology is going to be a meaningful tool to help. So it's free. We're going through this process of talking to as many community groups as possible to kind of provide the opportunity to share and get questions and feedback. And at least here on Oahu, the Department of Health is aiming for a rollout a week or 2 prior to Christmas. So hopefully by mid-December, there'll be a more robust Oahu campaign. So thank you guys for your time, and I'm open to any questions.
Aloha, Robert. Mahalo nui for that presentation. Question. Let's say that there is a high-risk patient that, like myself, I'm high risk. If I was to download the app and there's a COVID, positive member that hasn't downloaded the app yet, and then I share them the information, how quickly does that, how quickly does the app work with each other?
So with a person that doesn't have the app, you're saying?
Correct.
Yeah.
Doesn't have the app, is
is tested positive. Yeah.
Did the testing, did the quarantine, comes to the point where they do download the app. How does the transmission of the information of this app get notified to me? Like, you know what I'm saying?
Yeah. So I guess process wise, it's taken, at least when things were really bad here, it was taking the Department of Health, anywhere for up to a week and a half, 2 weeks, right, to notify people of exposures. The app notification process takes anywhere from a day to 2 days. Yeah. So that's really meaningful, right? When you talk about potential exposure and time to, go get tested and implement and intervene, right? Especially for high risk individuals, right? To go and get early detection is critical, right? To preventing complications.
Right.
So
what I'm hearing is if they do download the app, the Department of Health already has their information. It takes about 2 days for us to receive the information, like myself, that the person who just downloaded the app, who was near me, had the positive
Yeah.
COVID test.
It takes
Oh,
about
okay.
a day or two.
A day or two.
Yep.
That's awesome. Thank
But
you.
they have to have the app to expand the notification. Like it won't ping your phone unless they already had the app. So it doesn't. If you have the app and folks around you don't have the app,
That's correct.
it doesn't do any help. And so then it would be traditional contact tracing,
That's correct.
which is why downloading the app ahead of time, it's a preventative piece.
100%. Thank you, Steve. It's very analogous to even things like mask wearing, right? A lot of it is about protecting the people around you, right? And if everybody is wearing, or if everybody is sharing and utilizing the technology, or the vast majority, right, it's more meaningful and effective. So similar to that question, if not everyone has it, but at least a family member does, by extension, right? That could be helpful. Because I know maybe my grandmother may not. She doesn't always carry around. Actually, I don't think she uses her iPhone from 5 years ago. But that's part of the questions that we've been having, is about people who don't have technology access or don't utilize smartphones, right? By extension, by having family members that are representative of their family cluster, so to speak. Right, if that one family member ends up getting a notification, or that one family member tests positive, they can kind of help share and represent people in that household. So that's where it's still very meaningful.
So can I ask a question? We had the situation here on Kauai of a staff member at a local school who tested positive, but then tested negative. In other words, it was a false positive. Is there a cancellation to this somehow? Or if someone does test positive, but is no longer virulent, is that like 14 days, or how does that work?
No, so that's why the notification, rather than saying that, oh, you have COVID, the messaging is more along the lines of, go call your physician, right, and go get tested. So in the event that, for example, it turns out to have been a false positive, the individual who gets the notification and they call their physician, or get tested themselves, right, they more than likely will test negative as well. And that's also where I guess that 1-2 day delay is so that the Department of Health can, obviously, they're going to verify the test results. But I mean, those things will happen if people do have false positive testing results. So did I answer your question effectively?
Well, even if it's a true positive, is there a time when the phone stops pinging that this person is potentially contagious?
Right. So it's going to only ping, I guess, the log of people they've been in contact with from that point in time. So if that positive person tested positive, yesterday, the people that person had been exposed to for the past week or 2 weeks will be notified looking back. Does that make sense? It's not continuously pinging while that person's walking around for the next 2 weeks. It's all the past exposure. So that's why I think I understand your question. So if I test positive today, will the people that going forward be notified that I'm a positive person? Yeah, no, it's retroactive. It's looking back for the exposure. So it's relying on people after they test positive will go forward and quarantine and do the effective or the right preventative measures after that point in time. Are there any other questions?
So I'm just going to ask, if I want to put this word out to my congregation, and we have a website, And I looked it up. So it's wearealohasafe.org. And can I borrow the graphics and add
Oh, yeah.
them to my website? Okay, so that's
Yeah.
okay. Okay. And then I noticed too that if you leave a space between Aloha and Safe, the app doesn't come up. So, just got to be really clear. Aloha Safe is one word. Yeah.
Are you talking about on Google search or in the App Store?
It's on. I guess it's the app. Wait, what? Yeah, Google search. I'm sorry.
Okay.
Yeah.
That was also my experience in trying to download it from the Google Play Store, is that the phone automatically corrected it to put a space in between, which means that it didn't turn up the correct app. So I had to go uncorrect the correction in order to find the app, because I knew I had the picture of what I was looking for.
And that I appreciate that. And that's the other thing that Google Play Store operates a little bit differently than the Apple Store, but they're actually hiding the app until it goes live, I guess, more statewide. But yeah, you're able to find the AlohaSafe Alert app on the Google Play Store.
I have been working in an industry that is high risk. So I went as soon as this was announced, I went out and found it and downloaded it and activated it, and have been informing others. But I had to work really hard to find the app on the store.
Yeah. I apologize for that, but that was actually intentional. Yeah, it's because the Department of Health wants to do it meticulously county by county, instead of statewide all at once, which, yeah, we'll get there. Yeah. It's just they've been wanting to do it on a slow rollout procedure. And so soon enough, like I said, coming out later this month, it'll be very much visible, and there'll be more, media campaign type of things so that the general public will know about it. But having conversations like these, and when people are talking to their friends and family about it, at least you guys would have heard about it before, and kind of helping dissolve that immediate reaction of distrust and skepticism, right? When you hear about it, Department of Health says download this thing now. I mean, even for me, I'd be like, I don't know what that is, right? So, yeah, that's why we're going through these efforts beforehand. So you're actually, Kyle, you're actually one of the early adopters. Thank you for doing that.
So I had just looked under the exposure notification from I have an iPhone, and because I've never had this AlohaSafe Alert, it finally showed up that all diagnoses will be shared to AlohaSafe. However, you just said something. Not all states has this. So what about the County of Hawaii? Do we already have this going on? Like, is AlohaSafe already in process?
Yeah, so that's where so the short answer is yes. Right? This is the statewide Department of Health's program. What they're doing is they're making sure that they iron out all their own internal procedures, so that the case investigators, the contact tracers are trained to handle calls and walking through people through the process of putting through that code into your phone, right, to send out those notifications. So they're going county by county, and that's purely based on their staffing and training procedures. So Lanai was first, Maui County will be next, Hawaii County will be the third, Honolulu County is going to be last, I believe. Kauai County will be, I think, at the same time as Oahu County. Honolulu County, I mean. I'm sorry.
And the last thing, and I promise I'll let others. If we wanted to have you speak to our congregation also about this app, what do we do? Do we contact? Maybe David can share this as well. Do you think we should contact you folks, or should we contact our conference first?
Or you can contact me directly. I mean, I'm happy to do this again. If you guys felt this was helpful, I'm more than happy to do this as many times as I need to.
Yeah,
Um,
I think it's very helpful for especially high risk.
Like I said, I'm the pinch hitter, so you don't have the A team right now, but I'm happy to do this as many times as I need to. Yeah.
Doing great. We have a lot of high risk and high kupunas in our church that could benefit from this, but I think walking it through with them might be more beneficial. Thank you so much, Robert. Mahalo.
My family's from Big Island, so I'm more than happy to help you guys. So some of you guys have already downloaded it, and you've noticed how easy it is, but I can walk through that right now real quick, if it makes sense.
Yeah, can I ask a real fast question? When the vaccines come in, is it going to then tell us if the people around us have been vaccinated as well? Or
there are other add-ons and functions that the Department of Health wants to integrate this with. It all has to do with, I think, along the lines of HIPAA, health confidentiality types of things, right? And sharing that type of thing is I don't know if that's something that they're definitely researching, but integrating with things like safe travels program that they have, right? People coming in and the test verifications at the airport, as well as yet along those lines of your question regarding vaccinated people and people who have already had it, right, and are now have the immunities. That is definitely something that they will want to implement. And like going back to how this thing was all set up, the Department of Health has a team of volunteers now that are helping them develop this app. So there's ability to customize the app versus some other counties are utilizing an out of the box I guess solution that doesn't allow the health authorities to add different functionalities. And so as you can see in the app, it's linked to the Department of Health's, I guess, testing data and COVID data, like a little dashboard and stuff. So things like that. There's definitely ways that those types of things can be integrated.
If I can just add, I think one of the things that I appreciate about the app is that every step in the process reconnects with health experts. So the phones are pinging back and forth, but notifications don't happen until a positive test has been verified and the public health officials give the individual the code to enter in. So there's your primary contact. So if we get to a point where somebody tests positive and has the app, but the recommendations from the public health department is this does not require contact tracing and notification. It requires that individual connection with health experts before anything happens. And so and even the notifications, right? Like Robert said, it's recommended that you go and connect with your healthcare provider. And so the app in and of itself doesn't dictate anything, and it doesn't even collect any information about names and locations. None of that exists in a database anywhere. So the public health department can't go and track down somebody simply by having the app, right? The user has to connect with the health department, and the health department works with the user. So it's this partnership, and I think speaks to the way that Hawaiians connect with each other, right? That this really is a spirit of care and healthy suspicion, right? So we're not going to do something unless we know who we're talking to, and so that's what's really made it effective here on Lanai.
And I guess one of the things that, thank you, Steve, for that. Really appreciate it. That's awesome. And one of the other things that I guess groups and even like the business community, and I think even church groups like yourselves would appreciate is that oftentimes when there's a case or a cluster, right? There's the stigma, right, and the negative publicity that comes along with it. And so by having it being anonymous and not location-based, restaurants aren't going to be blackballed by saying, right, and being put in the newspaper that, 5 people at so-and-so restaurant down the street had a breakout. This church over here had a cluster, right? That's the Department of Health doesn't need to do that anymore, because people get notified through directly through the application, instead of having to put a public notice in the media, which is the only other outlet that was the way to notify people that they may have been exposed. So that's where the technology provides people's privacy. You guys will see how quick it is. I'll take 30 seconds to share my iPhone screen, if you guys don't mind. So right now I'm going to tap into the App Store, AlohaSafe. There it is. I'll download it. Get started. So we're adding different languages. Get started. How does it work? Your phone remembers other devices. Want to identify anyone. Privacy protected. What if I'm exposed? App will notify you. How does it work? Smartphones and app installed. Turn Bluetooth enabled. My data secure. So then right here is where you activate your exposure notifications in your settings. Open settings. And right here, it's in everybody's smartphone right now. So it's turned on.
Dude, you're going super fast. You got to be a millennial.
Oh, that's new. Shared travel status. So then AlohaSafe Alert will like to send you notifications. I hit allow, and then that's it. So at no point in time did it ask for my name, my address, my phone number, right? The app is not saving any of that stuff. Literally all it's doing is using your phone to speak gibberish to other phones, and that's all it's doing. So this is the home screen. It's connected to the Department of Health's data dashboard. So you can see it state level and by county. So when you have a verification code, if you test positive, you tap that, and this is where you click it in. I don't want to toggle that right now. Here's a log of exposures. I don't have any, which is good. And there's basically no settings. It's a minimal app because it's supposed to be passive, meaning that it just runs in the background. It's not something that you need to check or utilize every day. You download it and then you forget it. You can close it. It's running in the background. Because it uses low energy Bluetooth, it doesn't drain your battery as much. So that's it. Now it's running on my phone and saving interactions with people. And if any of them test positive, I'll be notified. That's all I gotta do.
I came in late, but I was wondering whether, is this something that the visitors or people coming from the mainland will be required to put on their phones, so there can be a little bit of a contact tracing that way?
Yeah, so Maui County is actually gonna do that first.
Would we, or could we possibly share this with a family or friend that might be not necessarily living here but want to come and visit family and friends, or family from here that want to go visit family up in the mainland or across? Is this something that we could even take the step in sharing that with them?
Yeah, can. I mean, the more people that use it, right? Like we said earlier, the more effective it is. And unfortunately, right, it would have been great if there was a national program that required, all the states to use the same one all at once. Fortunately, Google and Apple, as huge as they are, and the resources behind them, they're helping states stand these up individually on their own, which is okay too. But like, as you saw on that list, right, a good majority of a lot of the states that we have a lot of friends and family and we visit a lot, are using the same technology. So Charles, you're correct. It is helpful that, everybody have, or start using this app, regardless of what state they live in.
Robert, if somebody wanted to contact AlohaSafe to set up a conversation with their church, who would they contact? You directly, or how would they find you? What's the contact information? That's what I'm asking.
Yeah, so if you go to like AlohaSafeAlert.org or the wearealohasafe.org website, there's a contact link, but you can email me directly. Dave, you're welcome to share my contact information with everybody on this Zoom call, whether it's me myself or some of the other more technical experts can do it as well. So it all depends on whatever you guys want to do, and our availability as volunteers.
If there are no other questions, I'm going to go back and highlight, I think, some important things for us to remember. The app or the organization AlohaSafe is a nonprofit organization that set themselves up to develop this app in conjunction with the Department of Health with the state of Hawaii. It is the Department of Health that gives you the key, should you be exposed, to send that out, and then your phone will ping the phones of others. If your phone is pinged, it's because somebody who has the app, you were exposed to that person at some setting. So that's that partnership that is developed in there. As Robert has indicated several times now, this app works best when it is widespread use, right? So that's why we're asking our congregations, our kahus, and our pastors to think about this and to encourage folks to use it, so that we're part of the effort to reduce exposure, particularly spread. You can't reduce exposure, but you might be able to reduce spread, so that the health of our state is maintained, our health system is not overran, as we're beginning to see in some of the states back on the continent, where unfortunate spread is taken off much, much faster. So Robert, is there anything else around this piece that you would like us to know?
If you don't mind, like Steve, you said you're on Lanai right now. How has community, adoption and feedback been? I mean, it's kind of, I'm just curious.
Yeah, so one of the early pieces that the AlohaSafe team did was work with a few key leaders, and I was a part of that conversation in terms of messaging and rollout. And so then we've had really high participation in community meetings, especially since the outbreak a few weeks back. And so I think initially, the leaders really grilled the AlohaSafe team about privacy and really wanted to make sure that this was a program that we could support. And then because of all of the efforts that went in ahead of time, then I think leaders on the island have really been able to promote it and push it. And leaders make a huge difference. And so I've got folks in the congregation that are installing the app who wouldn't if we were relying on health officials to do that. And so we've got businesses that are encouraging employees to download it. And so I think folks are feeling comfortable. I think there was also this desire, like, we want these notifications in real time. Like I want to get a ping if I walk into the grocery store and the person in front of me is positive. But that's not how this app works. And helping folks recognize, no, this is really more contact tracing than immediate notification. So I think once folks recognize what the app does and doesn't do, then folks say, okay, well, I can download that.
So I had a quick question about businesses and, well, basically airlines. If I get on a plane and I have to turn my device off, I'm going to put in airplane mode, does it still Bluetooth and communicate with the Department of Health, or how does it store the information and then once I'm back in range, transmit, or how does that work?
Airplane mode, yes. Right. As long as your phone is still on, the Bluetooth is still working. So in airplane mode, Bluetooth still works. That's why this technology is meaningful even in situations like that where GPS doesn't work. But if the phone is off, I'm assuming not. I'm pretty sure no. Yeah.
Thank you all for your attention today. Thank you, Robert, for being a part of us and pinch hitting. Blessings on your growing family. Hopefully that all will go well with the delivery of your nephew or niece. Thank you all for your time today. Blessings, everybody.